In this demonstration, we'll be showing how the auto history function works. We will start a patient history, select a physician that the history is for, and this will ask questions pertinent to his specialty. Select a patient. Then we'll be asked a series of questions. The patient will be entering the history. And then the patient's told that depending on where they are, whether it's the first time they do the history or when they come back for a return visit, we determine the amount of time that they spend on the history and also the number of medical conditions they have. And we'll just say OK. And this is the first screen of the auto history, and you see it's a very complete list of complaints. We'll just go into I'm sick, and you see each one breaks down into another significant list of complaints. For our demonstration purposes, we'll just be talking about abdominal pain, and again, this will be an abbreviated version of abdominal pain. And we'll pick abdominal pain down there. And one of the first things that's unique about MedicalNet Systems Auto History is that there are diagrams, because it's very hard for people to point out where things hurt in a computerized program, and so we have that ability to add things and to show exactly where the pain occurs, and we'll just say it's right upper quadrant, but you can see they can change it back and forth as they desire. And again, here we're saying where's the pain spread to, and no matter how big a list you have, people are going to come up with other things, and so we have fill-ins. In this case, we'll have to my toes. We allow people to indicate dates. We have radio buttons. Again, all these different types of responses allow for the patient to tell their full history. Again, we have here how long an episode lasts, an interval, and a frequency, how many times a week that occurs, and we'll just say it lasts for 2 hours. 2 hours here. We have a list of associated symptoms, and rather than just saying yes, we have the ability to say no too, because denials are as important as saying yes to things, and we'll just add a couple denials here, but the patient would be filling all these out. And then again, we have another fill-in. We can add medications, or I should say the patient can add medications. And we'll start with a couple letters. And this is from the FDA drug list, and we have the medication there, and the patient can fill in the rest of the medication orally 1 time per day, and it was by this doctor, and we'll just put that information in. And you'll see the medications added there, and the patient can edit again if need be. Allergies work the same way. So off a pop-up, we'll say he's allergic to penicillin and has hives. We'll just add something here. This is the preventive medicine list, and this is important for the wellness guidelines, and we'll just say he had a colonoscopy a month ago. And that would be entirely filled out. We can show with vaccinations the same thing. We'll just say he had a diphtheria and tetanus about 4 months ago. Now, what we can go into here is we'll show you the smoking history, and the reason why I want to go into that is that this is really a big part of why the patient-generated medical history is effective. It does 2 things, and I'll show you this as we go along. We'll say a person smokes, and they ask how many packs a day, and we'll say it's for 20 years. But what they do is, with a lot of the high-risk behaviors that we talk about in our history, we present patients with a list of adverse effects from that behavior. And we'll just say they have a couple of them here. And again, we're just for speed, we're just going to go through. And they smoke in front of children. And what this does is, it does two things. As a physician, I can look at this list of things that people say and use that as part of my argument to get people to stop smoking. But also, while going through this list, they're aware of all the other complications of things they may not have, but could develop because of the smoking. And we'll just say it's $200 a month. And why? Most people don't know why they smoke, and that's generally what they put in there. Now, this is just an example of the adaptive questionnaire technology. If people don't want to quit, we go right on to drugs. But if they do want to quit, we ask further questions about, do they try to quit before, that sort of thing. And in this case, if they said yes, we go into a whole list of things they could have done. To try to quit smoking. And again, this helps us counsel the patient to help them try to stop smoking and realize that failure is just the first step to success. We'll just skip the drugs, but the drugs kind of work the same way. Now, you don't know how many hospitalizations a patient may be on, so we have a situation, again, like a pop-up, so we can add to the list. And in this case, we'll just say they had pneumonia, and it was in St. Joe. And they're hospitalized in 2005. And we could add multiple ones if we wanted to. Again, this is a question that we like to have fears and concerns, because no matter what we think the patient should be afraid of concern, they always have something else. And what you see here is that the patient gets to review the history that they just made. Now, as you noticed, with the abdominal pain, there's a lot of things that weren't answered, and that's because we had an abbreviated history. But the patient can go through and edit things. In this case, he can say his pain was moderate. And going down, there's medications that he was on, and the allergies, the preventive medicine, etc. And the smoking history there. And then we press when finished. We're done. That's the auto history. Okay, what I'd like to do right now is to show you a complete comprehensive history, and we'll go into TED full demo. I'm going in as a physician to open it up, but this will show you what this is actually accomplished in auto history and give you a feel for the comprehensive nature of the patient-generated medical history. And say we have a full abdominal pain, and we like to think our histories are kind of like third-year medical students, and it's a very extensive history of present illness. And I'll just scroll slowly. Significant illnesses, diabetes, high cholesterol, hypertension, allergies, medications, and more allergies, work history, etc. Those type of things.